The manifestation and likelihood of drug interactions increases as the number of drugs being taken increases. As such, people who take several drugs are at the greatest risk for interactions. Drug interaction is the interface between a drug and another substance that prevents the drug from performing as expected. This trend has no doubt contributed to the cost of healthcare because of the cost of medical care that are required to treat problems caused by changes in effectiveness or side effects of drugs. Lending his voice to the structure of health sector, a medical doctor, OLUWASEUN, said the medical doctor is the only one assigned with the role of drugs prescription, sequel to his position as the head of a medical team.
In the health sector, the head of the medical team is the medical doctor. He's not the pharmacist, he's not the nurse, he's the medical doctor. And he's a medical doctor that is licensed to prescribe drugs for you.
Babalola, however, charged Nigerians to stay away from self-prescription to avoid complications.
A lot of dangers associated with self-medications. For instance, when you go to the chemist, you ask them that you're having pains, they should give you what Yoruba people call akapo. They give you a lot of drugs, and in that drugs they give you something like diclofenac, they give you ibuprofen, and you are using it for a very long period of time. You can develop what we call peptic ulcer disease. You begin to have ulcer. In fact, some people it can lead to bleeding. You begin to bleed, and so it could be so severe that some people they will bleed to death.
In the same vein, the chairman of Oyo State Pharmaceutical Society of Nigeria, pharmacist Abiodun Ajibade, noted that drug interaction is a big issue in the health sector that can be challenging in the absence of adequate information.
So when we are talking about drug interaction, is a big issue which ultimately determines the outcome of treatment and can also be responsible for eventualities. This time around, I can say complications or untoward end, which means you can even bring another disease, another condition by virtue of just taking normal medications.
Ajibade therefore explained that drug usage should be discontinued once the side effects start to manifest on the patient.
But when you have these side effects, the first approach is to stop that medication. The next thing to do is to contact your medical personnel, your health professional, who will now guide you on the approach to mitigate the side effect.
Without mincing words, people fall victim of wrong prescription of fake drugs in the process of cutting corners. Hence, getting the right prescription from the appropriate channel is the best way to make drugs effective. OLUWASEUN OYEBADE, IATV News.